And Michael in Los Angeles. Hey, Michael, what's on your mind today?
Hey, Tom. Happy Friday. Thanks for taking my call.
Thank you.
I just wanted to kind of gloss back over the idea of socialism and including that with Medicare for all. I know I'm a smoker myself, and I know a lot of people who smoke or who make what people would consider unhealthy decisions when it comes to their health. And normally, when people do things like that, health insurance companies charge them higher premiums, or their insurance costs are higher. Do you think that in a Medicare for all system where we're paying through the system through our taxes in some sort of pool kind of system, do you think how do you think that should work for people who don't make smart health decisions? Or I shouldn't say smart health decisions, because I don't want to say like if you smoke you're not smart, but or somebody who chooses not to take better care of themselves versus the other person, and that's
no. I get what you're saying, Michael, and I would say I agree. Smokers are not necessarily dumb; they're drug addicts, and
right.
It needs to be dealt with as such. What you see in countries that have national health care systems is that, for example, when Denmark decided that they were going to encourage people to ride bicycles, so much so that the capital city of Denmark now, more than 50% of the people who commute to work do so on a bicycle. They took entire streets and turned them into bicycle lanes, and major changes. I mean, it's really safe to ride in a bicycle in Denmark. They took that public money and said, okay, we're going to spend X millions of dollars doing this, but you're going to save X millions of dollars in your taxes because people are going to be healthier and they're going to use our medical services less, which you're all paying for with your taxes. And people were like, cool, let's do that. In the Scandinavian countries, where smoking was very, very widespread up until about 2 decades ago, again, national healthcare system, they came out and they said, okay, the portion of your taxes that are being paid every year is this, that goes to cover smoking-related illnesses, and not to mention lost productivity, in the workplace, and lost family members in our families. And so, we're going to radically raise taxes on cigarettes. We're going to require the cigarette companies to put pictures of, blackened lungs on their packages and things like that.
Right.
And the people were like, cool, cut my taxes. So, without going all draconian or calling people stupid or even trying to regulate behavior like we've been doing here in the United States, you can't smoke in the building, all that kind of stuff. The countries that have a national health care system just pull together a national consensus. Hey, let's, again, the thing in Denmark, part of that was an anti-obesity campaign as well, because obesity is costing countries a lot of money.
Yeah, that's another thing. People who make decisions about their health in terms of obesity or in terms of things.
Yeah,
like
again,
that.
I would say that we're using the wrong frame here, Michael. I don't think that most obese people made a decision to become obese. You've got a whole bunch of variables, from genetic variables to apparently the kind of gut bacteria that they have, to a lot of poor people who are obese because they're malnourished. They're buying crap food because they're living off the dollar store, or or they live in a food desert. There's not a real supermarket around, so they just can't get fresh fruit and vegetables, and so they're eating nothing but packaged foods, and boom, that's a prescription for obesity. So I think rather than talking about this, that whole choice thing is the right-wing frame for pretty much everything. But I would say that, tobacco is 5 times more addictive than heroin. It's 10 times more addictive than alcohol. It's a major addictive drug. It needs to be dealt with and treated as a substance, as a medical problem. Obesity needs to be dealt with as a medical problem. Rather than a moral problem, or rather than a choice. And there's other things as well. Lack of exercise, another one. We don't exercise in the United States. It just doesn't. People, you walk around neighborhoods that have sidewalks, and you never see anybody walking on the sidewalk. You walk around, neighborhoods, even suburban neighborhoods in Germany. People go out for walks as part of their recreation. Well, they're also encouraged to, and they're encouraged through school, through kind of essentially social engineering, because it saves the health system of the country money. So that's how it works, and it's, I think, one of the most important reasons to go with a Medicare for all system is because it actually makes everybody healthier at the end of the day, and it encourages all of us to use your phrase, to make better choices. I would say to seek treatment, right? to have a healthcare system that says, you want to deal with your obesity, you want to deal with your smoking, you want to deal with your, whatever, your lack of exercise, whatever it may be. come on in. It won't cost you anything. Come talk to the doctor. We'll work this out. So, Michael, great points all. Thank you very much, and I hope you can figure out a way to quit smoking, or at least start, chewing gum instead, which is nowhere near as destructive to you as the stuff that you're inhaling.